deep front line leg points. And let's talk a bit more about this spleen 6 to spleen 9 area or band. So spleen 6 and spleen 9 are likely some of the most commonly used points in this area. We use these points for a lot of different patterns, and spleen 6 as the 3 yin crossing point, it demonstrates this line's role in treating internal conditions, as well as the correspondence with the deep front line. So where these 3 leg yin meridians meet at spleen 6, we've got the liver meridian meeting with the spleen and the kidney meridians. This corresponds with the way that we think of the deep front line and the way that it's related to the deep internal structures. Now, we'll use spleen 6 for many type of patterns. We use it for various types of spleen patterns. That might be spleen chi deficiency, or we might use it for like spleen damp even. We'll certainly use spleen 9 for spleen damp. And any other type of spleen patterns, it's not uncommon to use spleen 6. Now, we'll also use spleen 6 for liver patterns as well. Like if it's a liver overacting on spleen pattern, we can use spleen 6. We'll use spleen 6 if it's a liver yang rising pattern. That point will commonly be used. And we'll also use it for various kidney patterns, kidney yin deficiency. This point, I've seen it listed as a point for kidney yang deficiency as well, so you can needle like spleen 6 and kidney 7, and that point combination of spleen 6 and kidney 7, it's all reaching that deep front line, and that's going to influence the pelvis and the reproductive organs and the kidney and urinary systems. And so this is why we can understand how spleen 6 and kidney 7 can treat these types of conditions, because we're influencing that deep front line and the pelvic area. Now, spleen 6 is also used for various types of heart patterns. We'll use it for heart yin deficiency, we'll use it for heart blood deficiency, we'll use it for heart fire. So spleen 6 is a very commonly used point for many internal types of conditions and patterns, and this demonstrates the way that it corresponds with the deep front line, because the deep front line, it reaches those deep fascia that surround the organs, such as the pericardium, the parietal pleura. It reaches the pelvic area like we've discussed, in all these deep structures. It also reaches the anterior longitudinal ligament, which runs in front of the spine, and in that area on the anterior part of the spine, we've got close associations with ligaments and nerves and the connections of the internal organs to the spine. So this area then, it's a really important point and a really important area to understand, because it can be used for so many various types of internal conditions. Now, keeping with the Dao-Ma method, it's best to needle 3 points in this region when treating relevant disorders. Now, imaging still applies. We'll use the more distal points for treating the neck and the arms, and then we'll use spleen 9 for treating the abdominal and lumbar region. Now, when we take a look at the Master Tung points and the way that we use points in this area in that system, we find this correspondence again with the imaging, and we can compare that to our TCM actions and indications for these points and find that there's a lot of overlap here.